Joe Palmer, been practicing in South Carolina since graduation from the Medical University of South Carolina School of Dentistry in 1982. He's been a member since 2001. He received his fellowship, and he's our treasurer, and a very, very good one. Dr. Joe Palmer.
Thank you, Griff. So, now you know I'm an old man. Started practicing actually in January of 1983. I graduated from a 4-year program in like 3.5 years. They kicked me out to make so the other students would have patients, and so my wife and I started a practice. And I really started my history with amalgam and why I'm doing this, because when I got out of school, I was your typical dentist who placed and removed amalgams. So my wife quit her job, we started practice, built a building before I got out of school and took the board. I was too stupid to realize I might flunk that board and be sitting there holding money on a building, but that was how naive I was. So my wife came in and practiced with me. She was my chairside assistant. Of course, we weren't that busy. First 6 months, I mean, I take to tell you, the first year of my dental practice I only made $20,000. And she had a miscarriage right out of school. Found out we were pregnant. She sat chairside. We lost that first baby. A few years later, she really worked chairside with me about 6 to 8 months. And after the miscarriage, she kind of worked up front, and then she went home. But about 2 years later, she was having all these symptoms of fibromyalgia. They were diagnosing as fibromyalgia. And I said, well, I don't know anything, but I do know that fibromyalgia, they're just kind of labeling you with, and they don't have a cause. And I was working with a MD who was a pain specialist. He was doing some ligament injections at the time for TMJ patients. And so I said, why don't you go see Dr. Schwartz? And he diagnosed her with mercury poisoning, heavy metal toxicity. Well, I didn't know a thing about heavy metal toxicity either, but I knew something. She went through chelation and she got better. So here's dumbass me, still practicing, no protection, putting in amalgam, taking out amalgam, and I did that for another 14 years. So anyway, what happened to me? Well, finally, my personality changed. I got mean as a snake. I was probably looking back, probably was depressed, but basically my temper, boy, I would run some employees off for looking at me wrong. I was short my wife. It was hurting our relationship. We had a couple kids, but she said, Joe, something's wrong with you. And my joints were hurting like crazy. I could not. I was the first person in South Carolina to buy a wand, so I wouldn't have to push that syringe all day long. Because by the end of the day, I couldn't move my thumb. I thought I was done in dentistry. And she said, I think you got mercury poisoning. I said, how would I get that? So I go to Dr. Schwartz. He said, you're the second highest person I've ever seen with mercury. So I started doing some chelation. I actually had to do chelation over a number of years. Health problems I got from that. I had 2 heart attacks. That first one time I was 48, got a stent, no damage. Had another one a few years ago, probably 6 years ago now. So I battled heart disease, and you've seen from previous research from Para90 that mercury definitely can affect and cause heart problems and other problems in the body. So I'm one of those guys who did get sick. I'm one of those guys who wouldn't be standing here today if it wasn't for the colleagues in the IAOMT, for Bill Virtue, who got me started, who led me down a path of education so I knew what was happening in dentistry and found the right people to treat the problems I had. So that's why I'm up here doing this. All you young people, I said, all these young people, I saw all these young females out here who have even risk with their kids, they could pass this stuff along just by taking it home in your clothes. So I'm up here so you won't have to go through that, so you learn how to protect yourself, your patients, your team members, and that's what we're going to talk about today. So you won't be like dumb me who thought he was Superman, and when my wife got contaminated, couldn't figure out where that stuff was coming from. Because they told me it was safe. You know, you learned in school it was safe. But it's not. It's a neurotoxin. It's dangerous. It affects different people in different ways. You can have one or a combination of symptoms like I had. Coexisting factors like your genetics play a role. It can then take many years, as in me, for symptoms to get bad enough you're going to do something about it. I see people taking pictures, and you can take pictures fine, but all these slides are on your app. They're already loaded, so you can get back to all the slides later if you want them. So we've had different terms since I've started this stuff. Mercury-Free kind of came up, amalgam-free, and most of it's come from patients. They kind of labeled it. So now the label seems to be biological dental terms. You're a biological dentist now, if you follow these protocols. So mercury-free kind of means, a lot of guys say that mercury-free means they don't place mercury, and most kids coming out of school aren't placing mercury fillings unless they go to work for an old guy like me who places mercury fillings and they make them do it. And then Mercury-Safe means you use more rigorous safety measures. You do some protocols like we do. And then maybe the next level is biological, and you heard questions about vitamin C and how do you chelate and how do you advise your patients. So you learn more about the effects of mercury, and you help your patients find the right people to help them get it out of their body after you get it out of their teeth. And it's not only mercury, you learn more about the effects of other metals in the mouth. So basically a biological dentist never uses metal in the mouth. So there are no really mercury-free dentists, because you got to take this stuff out. Unless you just refuse to treat people who have amalgams, that's the only way you could be a mercury-free dentist, because we see this every day. And you've got really two forms of exposure to your dental teams and for you when you're placing or removing these fillings. And the most common when we talk about is mercury vapor, because vapor is always coming off the fillings. So even your hygienist can have exposure to mercury vapor if she's in there polishing those. We'll talk about that a little bit later. Now, removing the fillings is probably more hazardous than placing them, because you create an aerosol of vapor and particulate, and if you don't have any protection, you're going to inhale 80% of that vapor and particulate as it's in your breathing zone right around your mouth and nose. And then about 10 minutes later, it's absorbed, and it goes in the mercury in the lungs, it's transformed to the blood, and it's changed to methyl mercury in the gut and all other places and goes into the tissues. So we've got studies on all this stuff. This was done at the Department of Occupational Medicine in Monastir, Tunisia, actually. So the studies come from all over the world. And this was an exposed group, and their scores of dentists and their scores of neurological symptoms, memory disturbances, and anxiety were significantly higher than controls. They had depression mean scores were higher in exposed group than in controls. Most of the neurotoxic manifestations were correlated to the levels of urinary mercury excretion in the group. And so they concluded that increased levels of urinary mercury observed in dentists suggest that prevention should be strengthened with a special medical supervision program of dentists exposed to mercury vapors. But we've got all kinds of studies that show you are exposed when you take these things out. This was in the Science Environmental Epidemiology Journal. And it says exposures of dental professions to elemental mercury from amalgam and methyl mercury. So they studied 630 dentists at an American Dental Association meeting to assess mercury body burden. And they found that dentists have a higher percentage than the general U.S. population. And that the number of amalgams predicted the urine mercury levels, along with total years in dentistry, amalgams handled, working hours, and sex. So the longer you've been a dentist, the higher they found mercury levels in these dentists at an ADA convention. And that fish consumption didn't have a whole lot to do with it. So this I think came from the same study. They just expanded it. The ADA is doing this study. This was done back in 1983 when I started practice. They conducted DMSA challenge tests on over 4,000 U.S. dentists. Now, DMSA is a chelating drug. You take the DMSA, the sulfur group grabs the mercury out of the cells, and you measure what comes out in the urine. Because mercury doesn't naturally excrete in the urine. It's excreted in sweat, hair, and feces. It's a natural way the body can get rid of mercury. So their mean urine levels were like 14.2 micrograms. That's high. 19% were over 20 micrograms. 10 were over the CDC maximum of 30. And 5% were over 50, which normally you would see induced tremors in these kind of patients. 1.3% were over 100. Definitely they had tremors. So study after study after study shows our population that as a dentist, you're going to have more mercury than if you measured anybody out there who's not a dentist.
In 1991, the World Health Organization acknowledged that the predominant source of human exposure to mercury is from your fillings. That should be of concern to anyone. So all mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum. The dentist might send an old gold crown to the dental lab to be welded. How about the dental personnel? They're not being given informed consent. Back in 1985, the International Academy of Oral Medicine and Toxicology set out to determine the amount of mercury that was coming off fillings. And here's the graph, showing substantial quantities of mercury were measured coming off fillings. And then we estimated the total dose. And then we began animal experiments and put radioactive fillings in sheep. Mercury accumulated in the jaw, stomach, liver, and kidney.
Okay, y'all have seen those studies, the sheep, the monkeys, but they were actually sponsored and started by the IAOMT. So now we've discovered you're also exposed to particulate. We thought it used to be just vapor, but now we know that when we drill on teeth, we create an aerosol of particulate and vapor. And you absorb particulate into your lungs, it's just going to sit there for a very, very long time. Mark Richardson's a guy who's been, he's a PhD who's done a lot for our academy, and he did a risk assessment back in 2010 where he measured the U.S. population and tried to figure out, who was at a risk or how much risk of exposure there was to mercury. And he did actually lead, methyl mercury, and elemental mercury does occur in the U.S. population. And 1/3 of the U.S. population is concurrently exposed to all these different forms on a daily basis. That's more than 67 million Americans aged 2 years and older exceed the intake of mercury vapor considered safe, in parentheses, because none of it's safe, by the EPA. And that's all related to their dental mercury amalgam fillings. And 122 million Americans exceed the intake of mercury vapor if you look at the California level, which none of it's a safe level. So this was his inhalation of mercury-contaminated particulate matter by dentists and overlooked occupational risk, another article by Mark. And he says in this article, it's apparent that the single largest source of mercury exposure of the practicing dentist is removal. The dose of mercury contained in the amalgam particulate inhaled, the removal of just a small filling is far worse than anything you're going to inhale as far as mercury vapor. And you could take what you inhaled over a week, and what you inhale in one filling of particulate is worse than the vapor.
I researched all the literature on the occupational exposure of dentists to amalgam and ended up writing a paper as a result of that research that was published on exposure predominantly to particulate matter. As dentists drill out a filling, their dental drill runs at about 400,000 RPM, and it sends a shower of micron-sized and submicron-sized particles everywhere. It's tens of thousands of parts per million. There was literature actually that measured the amount of particulate matter in the airspace or the breathing zone of a dentist during removals, and a researcher had studied this using mannequins into which they had put in fake teeth with fillings in them and then drilled them out and taken all the measurements while they were doing it. And the dose of particulate matter experienced by dentists, if they don't take precautions, is huge. It's way larger than the vapor exposure they get during the same process. Particulate exposure for a single filling delivers micrograms of mercury, which in mercury terms is a lot. And this happens, at the time, the average was around 4 to 5 fillings were removed by a typical dentist in any given day so that he could replace them or whatever. And even if they wear the typical surgical mask, they're designed to stop particles of around 3 microns in size or larger, because that's the size of typical bacteria. Well, the particles of amalgam pass right through that mask because they're well less than 3 microns. They average around 1.5 microns in size and go down to the submicron level. The amalgam load would probably give them 100 times more exposure to mercury than just inhaling the vapor that is present at the same time. The particle load carries, 50% of the mass of any particular particle is mercury. And that's delivered straight to the lungs, and it's absorbed within 3 days, and the mass is quite large. And it stays there, as opposed to the mercury vapor drops off fairly quickly. The amalgam particles that have been inhaled, they don't dissipate anywhere but directly into the body. So the dose delivered is very, very significant.
So that's kind of scary. The little mask we use to prevent the cold virus from going through or whatever, they just actually retain the particulate. They just let it come right through. And if you keep using that mask on multiple levels, it just builds up. And so now you just breathing, your breathing zone closer in that mask. So the risk of the patient and your dental personnel and the dentist during amalgam removal is primarily due to that aerosol of vapor and particulate. So our real everyday risk routinely exceeds 100 micrograms. That's a dangerous level by anybody's standards. And that's in your immediate breathing zone, and it's even closer to your patient. So we're going to talk about how ways we want to minimize that risk today. So the chemical forms of mercury in hair, because you're going to hear a lot about hair testing. You'll have patients come in and say, well, I had a hair test, I didn't have any mercury in my hair. I said, well, you probably got a lot of mercury in your body then, because you'd like to have a lot of mercury in your hair. That's one way we excrete mercury is in our hair. So, and it's a lot of what's in hair seems to be methyl mercury. So you think it's coming from fish. But you got to remember, mercury is methylated in our gut also. The inorganic mercury that gets into the gut is methylated in the gut. So a mercury spike located by X-ray nanofluorescence on one hair strand could even be dated to removal of a single dental amalgam in this study. And they showed that when amalgam was removed, you get a spike in the hair if these people were excretors. So you got to protect your patients, and also you. The American Industrial Hygiene Association journal, they looked at in Edmonton. They looked at a work environment and procedures like 23 dentists and their assistants. They collected that data, and the results indicated that the greatest potential hazard may result from contamination of hands after working with mercury metal or fresh amalgam. Respirable dust in terms of total concentration and mercury content was also significant. This study also demonstrated almost complete unawareness of most dental assistants and of many dentists that mercury could be hazardous. And so constantly precautionary measures were almost non-existent. They obviously weren't IAOMT dentists. And in previous studies done back in the 80s by Nemo and Worley Martin, and Nemo is probably the first one that did it, he showed that mercury was absorbed through our skin, but he also did particular inhalation during the removal of amalgam restorations back in 1990, and it was published in the journal Prosthetic Dentistry. And they concluded that the use of water spray, high velocity evacuation, and rubber dam almost completely eliminated particulate inhalation by the patient, which is not quite true. And the simulation of the dentist was exposed to moderate amounts of fully respirable particles for all conditions tested, but this was done at a university dental school. And so when they came up with these things, they came up with, oh, well, you got to wear a mask, a cloth mask. They didn't realize that the mercury particles size, that mask had no protection. So systemic mercury levels caused by inhaling mist during high-speed amalgam grinding. This was done on rats, wasn't done on humans. And they showed it was immediately absorbed into the bloodstream, that the heart, ask me how I know, receives extremely high levels of mercury within minutes, 81 times the control. The brain and liver reach their highest levels within 16 hours, 7 times the controls. And the kidney levels rise slowly and remain high. So plenty of science. This is just some of it showing how this stuff's absorbed, where it goes in the bodies, to the organs, and the damage it can do. So through my saga of mercury increase, and I must be a mercury sponge. I'm sure my genes tell me I am. Because I would get chelated, and I started using our basic protocols we used to use, and I would still kind of have an increase in mercury every once in a while when I got checked. So I'd get chelated again. So we kind of talked about it. We don't know why that is. Maybe you never can get it all out. And I have just so much in my damn body from the 14 years I practiced without doing anything that I can pull out some more today. But we will get to the point in my chelation therapy when I would get down below 3 microns, which is what you're trying to shoot for. So we decided to do a study and kind of, with Matt Young, myself, Bill, David, Warwick, where we put amalgam fillings in typodont teeth, and we made a mannequin, and we simulated a patient with the mannequin, and we started out with all our controls on, and then we were going to take all control off, we do it again, take the next control off, do it again, take the next control off, do it again, so we finally get to where we're just practicing like normal dentists. And so Maddie said, you know what, we better protect ourselves more. So he came up with these spacesuits for us to wear, and we were covering the mannequin with a barrier because we were measuring certain square areas on each removal the same, and we were changing the sheet, so we wanted, a clean surface. And so we did 6 sessions of that, removing occlusal buccal mercury fillings, 4 from the right, 4 from the left. Then we would remove it every time. We measured vapor. We had a device measuring vapor. We had a device measuring vapor and particulate, which was sitting right here in front of our face. And then we had wipe samples where we measured where the particulate landed in the operatory. And now this was a limited study for particulate because, we're not all, we spent about $30,000, I think, on this study, and that was about all we could swing. And this is what we found. So we found when all our controls were on, there was still possibility of exposure. Now, we had masks on. We were talking about going through our respirators, but there's still stuff out there at high levels, so you need to be protected even with all our controls on. All our controls, we'll go over, but there's suction units and those kind of things, pulling things out, rubber dam for the patient, but I'll go over all that in a minute. So particulate and vapor, breathing, there was 3.3 micrograms, pretty high. The vapor alone, with all our controls on, was a little bit lower, 1.3, so you can see particulate makes that number higher. But the average of the total vapor, because the peak vapor doesn't really mean anything. You know, it took 15 to 20 minutes to remove all those amalgam fillings, but you breathe the vapor the whole time. So studies look at peak vapor, well, that doesn't matter because you can breathe in the low vapor too. So you got 160.5 micrograms of vapor in that whole time period, whether it's 10, 15, 20, whatever it took us. But the particulate kind of woke us up. Because on the patient's chest, we had 340 micrograms. So you got a little napkin on the patient's chest, or maybe you don't have it on there, and you deposited 340 micrograms of particulate, which releases vapor, on their chest. And so you got a young mom, and she goes home, picks up her kid from daycare. What's the kid going to do? Going to hug mama, right? Put her head right on her chest. Suppose the kid. On the assistant's knee, closest knee to the patient, there was 2.9 micrograms. Well, that was for one. What if that goes on all day long? So your assistant's leg's just getting contaminated with mercury. And that's just where we tested, because we couldn't test everything. But we just kind of tried to test the closest surfaces. And then with water and dental suction, which is the way most dentists practice, and they don't have the big vapors, those big suction units that we're going to talk about, you can see all the numbers were higher. And look at the average of the total vapor. Almost 3,000 micrograms in that doing that same thing just because we took off all the things we do that they don't do, which I'll be going over. And the particulate vapor went up also. But look on the assistant's knee. 360 micrograms of mercury, taking out 4 fillings. And the patient's chest went up to 1,900 micrograms of particulate. Those are really, really big and dangerous numbers. And Bill's program, there was a video. It was Randall's first video y'all saw, I think, and there's a guy in there saying these levels are highest I've ever seen. He's a PhD, he's an industrial scientist, and he works for a company that goes in and monitors where they have to be monitored, like the fluorescent plants, the alkali plants where they make bleach. He puts in the equipment and monitors those production processes. And when the levels get up to half of what they're allowed to have, now these people are protected. They're not walking around in their street clothes when they're down on that kind of production line when that mercury's there. So when it gets up to half, they have to shut down the process, ventilate the building well, let those levels go back down before they can start up the processing again. He was the one saying these are the highest levels he'd ever seen. That was in my office, old office, thank goodness, that we were doing this thing in, this study in. But that's where that came from. All right, so with all our controls in place, you have exposure. You can't think you cannot wear your respirator, mask. Particulate vapor is inhaled and it can be absorbed through the skin. You get enough on there, it stays on there long enough, you can absorb it right through your skin. You take it and put it on your shirt, walk around that shirt all day, you're going to be exposed all day. So this is David's daughter, Robin Warwick. She's been out of practice now a couple of years, but she did a study in her dental school in 2013. It's a wonder she graduated. So she wanted to measure exposure to mercury vapor while moving mercury fillings in a dental school lab where they had nothing. And she did measured levels with water and suction only, cutting high and dry. And she found that when water and suction were used, levels were below the threshold that Alberta Occupational Health set, but it was still 25 micrograms per meter cubed. And with suction only, or cutting dry, levels would exceed the threshold by 8 and 36%. So A notable quote from her study and from the results was that it is paramount that dental schools consider how dental students are trained in the subject of mercury hygiene when removing dental amalgam, as well as other procedures where mercury exposure may occur. They must also train dental students in effective use of personal protective equipment in order to prevent occupational exposure to mercury while in dental school and in clinical practice. We have a program right now in IAOMT where we are discussing with dental schools. They're not discussing back too well, but we're discussing with a few dental schools the possibility of us helping to fund a mercury-safe environment for their students to take mercury out. We have $100,000 sitting there waiting for somebody to come get it. They don't seem too interested. So the World Health Organization, they've stated that studies suggest that mercury have no threshold below which some adverse effects do not occur. So the ATSDR, which is part of the CDC, they set some levels, taking studies from different manufacturing plants like chlor-alkali plants, acetyl halide production, which uses mercury. And they defined a minimum risk level, MRL, for chronic exposures more than 365 days to mercury of 0.2 micrograms per meter cube. Never exceed that, 0.2. So you'll get 0.2 if you break a fluorescent light bulb, you'll get way more than 0.2. So if a fluorescent light bulb is broken, according to this group, you got to clear out the building. You got to bring in a hazmat team and clean it up. Based on this level. That's the lowest level. They have all these other different levels have been set. You can see they're all over the board. And these levels are intended to go into workplace environments, and a lot of it's based on what's the lowest you think you can get. When you're making a bleach and you got a vat of mercury as long as whatever football field or whatever it is, what levels can you maintain that at? And that's kind of where they set these levels in the workplace. But remember, those people are required to have protective equipment on. Well, we're sitting out here exceeding those maximum levels all the time in almost anything we do that involves mercury instantly, and we're not regulated at all. And ADA tells us we're safe. We're practicing safe. But you can't throw it in the environment when you take it out. So all these ocean limits we exceed just by opening a capsule, opening those chairside traps. When you clean those chairside traps, we'll talk about this, you need to have your protective gear on. You at least need to have your mask on, your respirator on, because you're going to release a big whopping thing of vapor out of that thing when you open it up. Polishing prophy polishing. 500 900 micrograms per meter cube. So what do we do with our hygiene patients? Do we suit up? Do we have all our stuff in there? No. But my hygienists are required to put on a respirator when they're polishing, and I tell them, do not polish them amalgams. Stay away from them, but put that respirator on. And they'll tell the patients, and it's amazing. If I were a patient, I'd go, well, let's go get them out. But some of them, not many, but some of them still have them in there. So that's how we handle it in hygiene. So Occupational Safety and Health Act, which doesn't seem to affect us too much. States employees have the right to know about workplace chemicals. You must have labels and safety data sheets. Y'all know this. You're supposed to train your employees to handle chemicals. And then training for employees must also include hazards of the chemicals and protective measures. So all my employees, we train in mercury removal and safety. Although it's not written down anyway. So what's the ADA say? Well, way back in 1976, they had this journal, and it's literally totally devoted to mercury. And there's articles in there about a father and son who got mercury poisoning in their office. There's an article in there where a patient came in and was mad, came in and threw mercury all over the office and contaminated it. There's articles over there to talk about exposure. And so they came out with this recommendations. Now this was when amalgams were beginning to get encapsulated, remember? So one of the solutions was, let's encapsulate the amalgams. Let's put it in a triturator and encapsulate it, then take it apart. That'll keep you from handling the stuff, not going to be in your hands. And then, of course, to use if you salvage it, you had to store it in the water, any scrap and everything. And you had to avoid carpeting in your dental operatories. Avoiding heating the mercury. Use water spray and suction when grinding it out. You know, the way every dentist practices, except if you're trained like we're going to train you. And you're supposed to alert the personnel, and you're supposed to have safety equipment in there if you spill it. This was all printed in that 1976 journal, and that's all they still recommend today. Also, you can't get a copy of that journal anymore. Oh, we didn't microwave. We didn't micro whatever they do for that one and put it in the library. So you're supposed to have these spill kits in your office. Well, I'll be honest, I don't have one because I don't have anything to spill. All right, so.
Will I start to feel like Superman? Then I pick a fight, only to find that my opponent's holding kryptonite. You think I've learned my lesson, but I'm still paying dues. Each time I drink and start to think I'm 10 feet tall and bulletproof.
So, my 29th year in practice, I had 45 micrograms of mercury still in my system, and I had a second stent placed in my heart. Don't think you're Superman. I practiced like Superman for 14 years. So what we've done is we've come up with our SMART technique, safe mercury amalgam removal technique. And the sole purpose of this technique is to protect everybody in the office that's dealing in mercury removals. Well, I'm not going to say placements because I doubt any of you would place an amalgam.
Taylor here. I'm really upset with what I've learned, and here's why.
These silver amalgam fillings in our mouths are made out of poisonous mercury, which is highly toxic.
So toxic that the United States signed on to a United Nations global treaty with over 100 other countries to protect human health and the environment from the adverse effects of mercury.
That mercury in our mouths? That mercury in our silver fillings?
Well, it's been proven that those amalgam fillings release mercury into our mouths 24 hours per day.
And getting them taken out can also cause even more dangerous levels of mercury exposure. So that's why it's important to have them removed safely. Make the smart choice to protect your health by watching the following videos and educating yourself about the safe mercury amalgam removal technique, or SMART, from the International Academy of Oral Medicine and Toxicology at www.thesmartchoice.com.
So those were actors, but it's part of our PR campaign to get this out to the public. We're trying to take it to potential patients, teach them, and it's working. We have 350 dentists in the academy are SMART certified, 150 are in line to get SMART certified. We have different levels of recognition in the academy. It used to be your first level of recognition was accreditation. Accreditation is a little more intense. You got to study a little more and take some more tests. But we wanted you to be able to get SMART certified in the academy just by starting to use the protocols. So it's a first level entry. And then you can move on up to accreditation. It requires some of the things that you need to be an accredited member of the academy. And then we have fellows. And fellows are people who have done a little research, they've done a scientific review, they've put in a ton of time in the academy. That's fellows, and then we have Mastership, which means you've really given a lot of time to the academy. So those are our different levels of accreditation and recognitions on our websites. We'd love to see everybody in this room that are dentists be SMART certified. It's easy to do, and it's not very expensive. So a couple more, and then we're going to go over some protocols.
I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. This is a demonstration about the unsafe levels of mercury that are released when a dentist drills out a mercury amalgam filling from your tooth, and how the safe mercury amalgam removal technique, or SMART, can protect you. In this segment, a dental mannequin was used for safety purposes because without all of the essential components of SMART, the levels of mercury exceed government safety limits. In this segment, on a real human patient, all components of SMART are in place, and levels of mercury are kept below government safety limits. As you saw, using SMART protects the patient, the dentist, the dental staff, and anyone else in the room from unsafe levels of mercury. Make the smart choice about protecting your health by having your dental mercury fillings safely removed. Find out more about the safe mercury amalgam removal technique, including how to find a dentist certified in SMART at thesmartchoice.com.
So, everybody needs protection. The patient, the team members, and the dentist. Anybody in the room. And dispersal alloy, let me find, I can't get this into my slide program, which I don't know why. This is a sheet that comes with dispersal alloy. And you'll see in warnings, right over in here, they all contain mercury. You need to avoid skin contact, eye contact, ingestion, inhalation, precautions. You need to wear suitable protective eyewear, clothing, mask, and gloves. Protective eyewear and whenever possible, barrier techniques such as rubber dam is recommended for patients. So the manufacturers know that they're giving us poisons to deal with, and they're telling us we should be doing all these things that we're doing in the SMART technique. But the ADA can't quite come up with the guts to say that. All right, where'd you go? So the manufacturers know. They tell us, of course, we don't ever read that stuff if you even buy one of those. But that ignores us. So, universal precautions of AIDS give us no protection from mercury. We've already covered that. So we want to talk about procedures that protect the patients, which you can use a pre-rinse. And you can do a slurry of charcoal and chlorella, or what I use is N-acetylcysteine with vitamin C. And you can have them swallow any of that, rinse around their mouth and swallow it because it's a pre-rinse. There's also a Quicksilver IMD protocol, intestinal metal detox. And Chris Shade has now come up with a really package of everything you need there. And he's really reduced the price and gotten it down so it's really affordable for the patient. So you need to check out Quicksilver Scientific and look for their protection protocols. We need to use full body barrier protection, including head and face protection. You need a nasal air supply for the patient, which can be oxygen, it could be compressed air, it could be air you get from a scuba tank. It just depends on how you want to go rig this thing up. And we'll look at some ways to do this. You want to use a vinyl dam and nitrile gloves, and then we coat the dam with this HGX cream, hand cream, and that's the name of the stuff, HGX. It helps trap particulate and reduces further the vapor penetration. A vinyl dam has less vapor go through it than a rubber dam does, which is why we want to use rubber material rather than latex material. Of course, a lot of you patients won't have latex anywhere near them anyway. We put a saliva ejector under the dam, and the purpose of that is to try to draw any vapors out that gets through it, or anything that gets through it, because things will get through it. You're going to do some eye protection for the patient, or have them completely covered up. All right, let's go. Thank you. Well, let's do that. We're going to use a team-up suction device. I'll show you what that looks like. Auxiliary suctions are big suctions, mercury filtration suctions. You know, they're like the machines when you came out with a little spray thing that took cavities out, and kind of the machines that came with those are similar to that, except they have mercury air filtration in them. Of course, you're going to need lots of water. And with your conventional high-speed suction, you're going to section the mercury and take it out in as big a pieces as you can, creating less particulate if possible. And then we'll do them, get all done, we take everything off, we do a post-rinse. You can use a slurry of charcoal and chlorella, or again, the N-acetylcysteine with the vitamin C in the vitamin C mixture. They don't swallow it this time, they spit it out, or you suction it out. So our patient barrier protection looks kind of like this. If you can't see the patient, you're doing a good job. All you need to see is the teeth, okay? Some patients are going to be claustrophobic. The biggest problem, the only problem you ever have, is the claustrophobic patient. So you have to talk some of them through it. Some of them you have to might give a little nitrous, or some of them we have to do sedation on, do some conscious sedation. But most, that's such a small amount that it's really not a problem. But that, I've never had a patient go, please don't protect me from the mercury. They've come in there knowing mercury is bad, and they want to be protected. When I first started, and I started putting a mask on, I would simply, I hadn't built up a clientele that it's like just comes in and asks now. And this, I would say, all right, I'm going to wear this mask, because that's all I was doing back then. We weren't even doing this. I said, I'm going to put this mask on because I need to be protected from the mercury vapor I'm going to create coming out of this tooth when we take this mercury out. Is it okay if I protect you? Oh yeah, please protect me. And we put, back then it'd be a rubber dam in the suction unit. So this is stuff, what's it cost? Well, this is a Tyvek hood that I have on her. It's like $1.75, and then this Material Concepts is a big old roll of Tyvek. And we have it fixed in the office where we just pull it out, cut it, and we use that to cover up the patient, and that's about $1.50 a patient. And then we've got basically it. You got your rubber dam, your suction things you'd be using anyway, so it doesn't cost a whole lot of money, but we definitely do charge for it. Now, this is not the only way to do it. I don't care what you cover up the patient with. You take an old trash bag and have them put it on. It's all right with me. It doesn't really matter. There's no perfect barrier because Tyvek's made to breathe, but it's also made to trap very small particulate. This is what they wear. These are the suits they wear when they're going in to treat patients with Ebola virus, very small particle. That's what it's made for, but it is made to breathe. So it lets vapor through, but it's not going to let the particulate through. We use a vinyl dam on the patient and this suction device called a cleanup, which has a little trap around it that you put over the tooth, and you can trim this. When rubber dam's in the way, you kind of trim it a little bit to get it on there well. But it definitely does work, and we showed that in our study where we took this off. We saw the particulate go up, so it does work. You can't use it in every situation. It's got problems. The end of it's disposable, and the tube is, you know, it's a little more expensive, like $8 or something. So you tend to reuse it, but it's going to get mercury in it. It's going to get dirty. It's going to get dark. And we're kind of in the process of trying hard to make it as a disposable unit, and we haven't got anywhere to manufacture very far. We do have some things we spray on it called Mercon spray, which will come up in a minute. You need to really coat this stuff with the Mercon, try to keep the numbers down. But this is a problem, but it's part of the smart technique, keeping it clean. Need to throw them away, probably more than I throw them away. Going to use a nasal air source. Now this is just like a mask that comes off my nitrous unit, and I just have oxygen turned on. You want to make sure you just make sure a little nasal cannula is probably not good enough, unless there's some coverage to keep the vapor out of the nose. You do not want them breathing room air while you're doing that. You don't have to use oxygen. Like I said, you can use compressed air. This is the HGX cream. Rub all over the dam to decrease the permeability of the dam to the mercury vapor. And it also helps trap some particulate. And in that one, I don't know what that looks like, a human hair. I don't know what that is. But Might be on the mirror. I'm not sure. I might need to make a new slide. I just saw that last night. And then we have engineering controls. Engineering controls are kind of machinery that you're going to have to, that you buy to help reduce the mercury particulate. And to make sure your office is designed correctly, you need to make sure all your suctions are vented outside the office. So you got an equipment room. If your suction unit, that big suction unit in your equipment room, is not vented to the outside, you're just sucking vapor right back into that equipment room. And then that's being put into your compressed air compressor because it's sitting there and it's got to get air from somewhere. It has an outside source. So you need to make sure that stuff's out of that room. Most building codes would require that, but some offices we've talked to have found out when they go back and look that it's not vented outside. So make sure it is. And then make sure it's not vented right where you're bringing air into that room. If you got an air intake right next to it, that's not good either. So we have these auxiliary suctions. Big boys, this is the IQ Air. Very important, probably the most important piece of engineering equipment you can have. I also have the Den Air back. I don't know if he's here this time, but he's usually here. If not, he's sent one you can go bid on and maybe get a little better buy on it. Very good unit, and he's changed his tube. It's really a good unit. That's the ones I have. I have a couple of those. This is just a little manufacturing stuff by the IQ Air, and I tell you they do work because the first thing we did when we were doing our particulate study, we measured the outtake where the air comes back out and make sure no mercury was being missed. Both units are very effective. Nothing was coming out of them.
What do you do? Do you have a filter that gets
Yeah, you have to change the filter every once in a while. There's a charcoal filter in these that collects the activated charcoal, which collects the mercury vapor in particular. Change them about every 6 months. Again, nitrile gloves because they're more, we don't have latex in them, but they're more resistant to the mercury vapor, but you can still go through them. The HX hand cream, you can apply the hand cream to yourself. It will help protect you, a couple times a day if you're doing a lot of procedures. It's made to clean up mercury. And then this company called Mercon, they make these wipes, like towelettes, like little baby diaper wipes. And we use those to wipe down everything. After we get all the mercury out, we take everything off. We take all our barriers, we get them outside the office, and then we wipe down the room, rinse the patient out, reset the room up, we clean instruments and everything, and then we do the restorative work. These that Mercon's available at Ross Healthcare in Canada, and they have all kinds of stuff you can get, trays and everything. And then in the States, you can get it through Granger or Uline. I think Uline has it too. And come on, that's the code for them. At the time I did this, those wipes were about $60. And like I said, y'all can get these slides. They're all, you can look up those numbers. We're going to hold questions till the end, okay? This is your clean up oil suction. You get that through the IAOMT. We're the U.S. distributor for it. And we're trying hard to improve that. Then I have a whole room air filtration system, which just runs all day. It's quiet. It's not loud like those others. It has a charcoal filter. This one has a UV light in it. It gets dust. It's got a HEPA filter on the front. So it just helps keep your air clean all day, and we just turn that on and just leave it on. And E.L. Faust Company, they'll be here, I'm sure. They make all kinds of these units. They've been coming for years, and they're a good company to buy this kind of stuff from. So how about the dentist? Well, the biggest thing is you want to not breathe this stuff, and you don't want to accumulate it on your clothing. So we have a couple different kinds of masks. I like this 3M full face mask because I just think it's more comfortable. But the problem with that face mask, you can't wear your loops if you're used to working with loops. And magnification, it doesn't work too good. So we also have this Comfo Classic mask. It has particulate filters on it also, mercury vapor and particulate filters on it. You can wear your loops with that, but then you probably should use a face shield with it also. just to keep it off your clothes. Here's Dr. Call. This is a very old film, but he's now, he wears a face shield and a hair hood too, but I don't have a picture of it. But he uses a positive pressure mask. He's got this hooked up to his compressed air system. And the patient's on, so he's a tri-way thing on that. And we have a new exhibitor that has that all done for you, I think. So you need to stop by his booth. What's the name of the company? What's the name of the company? M-Safe. Go by the M-Safe booth. I haven't seen it yet. Talked to him like Dr. Davis last night. But go check this out. This might be a really nice way to take care of being able to provide an air source for yourself, your assistant, and your patient at the same time. So here's Dr. Warwick. There's a mercury vapor mask. You see the black mask on the left the assistant has on? He has one also. And then they put their other mask on also to cover that up. So that mercury vapor mask is we also sell at the booth. He uses that and a face shield and then covers up with surgical gowns and hoods. Patient's got some other drapes, surgical drapes. But everything's covered up. This is my office. This is me and my assistant working on a patient in my office. We just use these, I like these Tyvek suits. I don't like them because they're hot, but I like them because you can stick your feet in there. Your shoes are even covered up. So you're not going to track that stuff too bad back to the house or whatever. This is what's scary looking to everybody that goes through this program. They go, oh, God, I can't do that. It's going to mess my hair up. Yeah, it will. And it's hot, but it'll make you be faster dentist because you don't want to be anything long. I mean, any of the stuff. Surgical gowns, I sweat more in a surgical gown than I do these things. But like I said, I'm not there long. In fact, shorter the better. So I just try to get everything out very, very fast. This is Dr. Young. He does pretty much the same protocol I do. But all this is acceptable. And then all those instruments laying back here on that bracket table, the ones you're not using to get mercury out, just cover them up. Just put something over them. And then the ones you do use to take mercury out, get rid of those. When you get the mercury out, you get fresh ones out that aren't contaminated, and you take those, clean them up, and run them through your sterilization and everything. So you're not using contaminated instruments. So suction tips, get rid of those, replace them, all that stuff that's thrown away. This is our NSL cysteine. Just take a capsule of that, mix it with a teaspoon of the vitamin C and some water, and we make that up first every day. And that's what we use for as a post-op or pre-op rinse also. But the post-op, you don't swallow. Pre-op, they can swallow.
I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. Patients and dentists should make sure that each step of the safe mercury amalgam removal technique, or SMART, will be applied during a dental appointment for filling removal. The first step is for patients to consult with their dentist before the mercury filling removal begins, so that both the patient and dentist agree that all safety measures will be in place. This helps to ensure that the patient and dentist know exactly what to expect. It's also helpful to watch the following example of the safe mercury amalgam removal technique, or SMART, being applied. Each room where mercury fillings are removed should have adequate filtration in place, which requires a high-volume air filtration system such as IQ Air Dental Mercury FlexVac or similar device, capable of removing mercury vapor and amalgam particles generated during the removal of one or more mercury fillings. If possible, windows should be open to reduce the mercury concentration in the air. The patient should be given a slurry of charcoal, chlorella, or similar absorbent to rinse and swallow before the procedure unless the patient declines or there are other contraindications making this clinically inappropriate. Protective gowns and covers for the dentist, dental personnel, and the patient should be in place. All present in the room should be protected because substantial quantities of particles generated during the procedure will elude collection by suction devices. It has been demonstrated that these particles can be spread from the patient's mouth to the patient's knee and to the chest, shoulder, and neck of the dentist and dental assistant. Either a properly sealed respiratory grade mask rated to capture mercury or a positive pressure, properly sealed mask providing air or oxygen should be worn by the dentist and all dental personnel in the room. Non-latex nitrile gloves should be utilized by the dentist and all dental personnel in the room. Face shields and hair head coverings are to be utilized by the dentist and all dental personnel in the room. In order to protect the patient's skin and clothing, a full-body impermeable barrier should be utilized. External air or oxygen delivered via a nasal mask for the patient also should be utilized to assure the patient does not inhale any mercury vapor or amalgam particulate during the procedure. A nasal cannula is an acceptable alternative for this purpose as long as the patient's nose is completely covered with an impermeable barrier. A saliva ejector should be placed under the dental dam to reduce mercury exposure to the patient. A dental dam that is made with non-latex nitrile material should be placed and properly sealed in the patient's mouth, as well as a full head, face, and neck barrier that is under and around the dam. During amalgam filling removal, the dentist should utilize an IQ Air Dental Mercury Flex Vac or similar device in close proximity to the operating field, that is 2 to 4 inches from the patient's mouth, to mitigate mercury exposure. High-speed evacuation produces better capture when fitted with a cleanup device, which is preferred. Copious amounts of water to reduce heat and a conventional high-speed evacuation device to capture mercury discharges should be used to reduce ambient mercury levels. The amalgam should be sectioned into chunks and removed in as large of pieces as possible using a small diameter carbide drill. Once the removal process is complete, the patient's mouth should be thoroughly flushed with water and then rinsed out with a slurry of charcoal, chlorella, or similar absorbent. During the opening and maintenance of suction traps in operatories or on the main suction unit, dental staff should utilize the appropriate personal protection equipment described earlier. An amalgam separator should be properly installed, utilized, and maintained to collect mercury amalgam waste so that it is not released into the effluent from the dental office. Dentists must comply with federal, state, and local regulations addressing the proper handling, cleaning, and/or disposal of mercury-contaminated components, clothing, equipment, surfaces of the room, and flooring in the dental office. I hope that you'll make the smart choice about your dental care by asking for safety measures during your mercury filling removal. For more information about the Safe Mercury Amalgam Removal Technique, or SMART, including scientific research about why these safety measures are important, visit thesmartchoice.com from the International Academy of Oral Medicine and Toxicology.
All right, so this is some of the other stuff we've put. It's on YouTube. These are available to our public, potential patients, and they're also available to you from our website. So one thing we haven't talked much about yet, but we'll go into is about our amalgam waste and what we can do to protect the environment from the stuff we're causing, okay? So mercury does get into the environment, and it's through a lot of sources. This is a little good film about how that happens.
Mercury is one of the most toxic elements and a persistent traveler through our environment. So who's the travel agent for this elemental poison? Coal-fired power plants? Most definitely. Mining operations? Of course. Your neighborhood dental office? Surprisingly, yes. The United Nations Environment Program reports that 10% of global mercury usage is for amalgam tooth fillings. This results in up to 340 tons of dental mercury journeying into the environment each year. In the United States, dentists are currently the largest users of elemental mercury. This accounts for roughly 32 tons of mercury used yearly to place amalgam restorations, otherwise known as silver fillings. Although the number of amalgams placed has decreased over the last few decades, dentists still use amalgam without precautions, so the threat of mercury exposure continues. Dental mercury travels many pathways on its journey back into the environment. It starts when a dentist receives precapsulated dental amalgam. In each capsule, up to 900 milligrams of elemental mercury is separated from the other alloys. To make the final product, the capsule is vigorously shaken in a triturator to thoroughly mix all the elements. Occupational safety concerns arise because this heats the mercury, creating thousands of micrograms of mercury vapor, which are released upon opening the capsule. The used amalgam capsule still contains a small amount of mercury, so the ADA recommends the capsules be stored in an airtight container and collected by a hazardous waste company. Unfortunately, the majority of dentists toss the capsules into the trash. This mercury-contaminated trash will eventually travel to a landfill, where the mercury will continue its trek down into the soil. Back at the dental office, the freshly mixed amalgam is placed into the tooth. The dentist then carves away any excess material. While patients swallow some amalgam waste, most is suctioned out and flows through a filtration system. But this system only captures a small % of the larger pieces. The vast majority of much smaller pieces escape into the wastewater. A similar scenario plays out when dentists replace amalgam fillings. Many dentists clean out their filtration systems by dumping the captured mercury-tainted sludge down the drain. A study funded by the ADA estimated that amalgam fillings contribute up to 50% of the mercury found in wastewater. This contaminated water then flows to publicly owned water treatment plants. While efforts are made to remove the mercury from wastewater, most of it settles down into the sewage sludge, which is then taken and spread on land as fertilizer or deposited in a landfill. In both scenarios, the mercury constantly off-gasses into the atmosphere and seeps into the ground. A percentage of the sewage sludge is also sent packing to incinerators. With over 200 tons of dental mercury in the mouths of Americans, even exhaling is a contributor of mercury to our atmosphere. Additionally, people with amalgam fillings serve as hosts for mercury's passage back into our environment through the excretion of human waste. Mercury's ride continues even after death. Crematories, which are unregulated and contain no filtering processes, are a growing vehicle for transporting mercury back into the atmosphere. When all the various pathways are accounted for, dental mercury from the United States contributes roughly 28.5 tons into the environment each year. The governments of the world are actively working together to reduce the amount of mercury released globally to protect human health. The first and foremost step to eliminating mercury released from dental amalgam is to discontinue the use of this toxic material. With the threat so great and the solutions so simple, it's time to restrict mercury's passport.
All right, so what are we going to do with this stuff? What do you do with the contaminated rubber vinyl products? The gloves. So what we do is I have a little airtight canister that's in the operatory, and as soon as we get done, the vinyl dam, the gloves, we take them off, we put them in this little container in there, and then they're transferred to a bigger container. And we send them off and have all that stuff. When it fills up, it goes to a company called Stericycle. And they hopefully know what to do with it when it gets there. And I stay, when these things are opened up, you need to have protection on because there's going to be vapor released out of that barrel. When it gets full, it goes off. And I probably have to send that off every 4 to 5 months. The larger barriers, and this is a problem with them, is not the best solution. They go into the trash outside the office. If you're going to keep them inside the office, you need to bag them up and seal them up in a container till you can get them outside. Because there's going to be some particulate on there, and how much is actually released off of there, we haven't done the study. It would vary for every procedure anyway. But our wastewater we can take care of. And now the EPA has mandated we have to have separators. So it only takes a half gram of mercury to contaminate a 10-acre lake. And there's every waterway in South Carolina and most states is contaminated, and we have warnings about the fish we take out of our lakes. And there's several kind of separators. This is Bill's, I think. He has a Rebec system. This is a good system. We also have the Mars Company. We have the Boss system. We've got a scientific review that you can look at. This thing rates very, very high. It does a very, very good job. And I think we got a little special visitor from the Boss system. Is Kim gone? Is she there? There he comes. We got a little Boss canister that looks like R2-D2. Yeah, you can take a picture with R2-D2. Look out. All right. Can you get that where they can see it?
I was going to put it on the other side here, but I couldn't.
Okay.
It does move and play.
Wish we could take him in the operatory, let him take the mercury out. Uh-oh.
I broke it on the way in.
The Liberty Boss is the best technology available in amalgam set.
You can read that and hear that later.
Okay. So
I have to fix it.
they've been great. They've come to every IAOMT meeting I've been to. I want to take this time to plug our exhibitors and like y'all to go support our exhibitors. Highly recommend this system. And they're doing a special promotion. We have a lady that's been diagnosed with stage 4 cancer. I'm not sure what kind, but she's been coming for years to exhibit. It's Dora Rhoda, and they are donating part of their sales to her GoFundMe page because she's trying to beat this cancer with a lot of alternative methods that aren't covered by any kind of insurance. So, good reason to buy from them today if you need a separator. It's a very good one. Okay. When you put these things in, you can get quick disconnects on them, so it makes it easy to change. When they need to be changed, you just get a new unit, and you pop these quick disconnects off, and it's quick, so you don't have a lot of exposure in your equipment room, and everything's sealed back up. And you ship this container off to get it recycled. Okay. And then your line cleaners, if your line cleaners contain bleach or chlorine, that increases the release of mercury from the amalgam that's trapped in those lines. So you need to use a chlorhexidine gluconate. They have one called PowerLens to use that to clean your lines, and you need to do it every day. I mean, it needs to go through your lines every day. So, little joke here, why are we not supposed to eat humans anymore? Because they contain toxic levels of mercury, thanks to all the fillings that are in their teeth, and because we've put all that stuff in their environment. So, have you been, if you're like me, I had an office. I'm on my 3rd office now that I've built, but my first office, I'm sure I contaminated that thing. And it had some carpet in it. So, you don't want carpet in your operatories. You want solid surfaces that can be cleaned, can be mopped. And if you're at an office that you bought or gone into and it's got old stuff like that, and you need to clean it out. You need to get rid of it. You need to rip the carpet out and put down some hard surface floors. We do have a mercury vapor analyzer you can rent from the IAOMT that you can take back to your offices. You can test your surfaces and see if you got contamination or not. And if you do have contamination, you can clean it up with flowers of sulfur or some of the Mercon decontamination products. And you can decontaminate your surfaces and possibly your autoclaves. If you had any unused amalgam in your office, you need to get rid of it. You need to recycle it. You need to pull up all the carpeting, and replace it with hard surfaces. You need to get rid of drapes. Any fabrics that are in your operatories, they need to go. We're also going to talk about becoming fluoride-free. It's just like you just got to stop. You just draw the line in the sand. When I quit placing amalgams, it was in '97, and I'd been to see Dr. Bill Strupp, so it was really a restorative decision to quit placing amalgams at that time. And I was beginning to get patients kind of requested a little bit, and I was just, well, okay, whatever you want to do. But I was still putting them in. But I came back from this meeting, and I just walked in the office, and I told my team members, I said, all right, girls, get all that Mercury stuff up, take it to the free clinic, donate it, get it out of the office. I don't want to see it again. I'm not putting another amalgam in. And one of my little dental assistants, country as she can be, good little Christian girl, never heard her say a curse word in my life, and I've known her since she babysat my kids, since she was about 12. She said, well, that's about damn time. So we just stopped. And the same thing when I stopped doing fluoride, we just stopped. Actually, you know what I did with the fluoride? This is a good story. I was in a basement of it was back in cosmetic days. I was in the basement office, walkout basement of a plastic surgeon's office, a big, big office building. And a nice big office, nice pretty office, looked out over a golf course. But there was a little mouse that was in there. And we kept finding these mouse clippings, and they couldn't get him, so I said, I know how we'll get him. We took our fluoride, put it in little plates around the office. The mouse ate the fluoride and got rid of him. Because it's a rat poison. That's what fluoride is. Okay, so you'll learn that today. And it worked. No more mice. All right, we now have fluoride-free and BPA-free composites. And the ones I use are from are Admira Fusion. They're from the Voco company. So I use their products. And they have flowable and they have packable composites. I'm not sure if there are others out there yet. I think this was the first one. It's a different chemistry. There's chemicals in there when you read it. I have no clue what they are. Hopefully they're safe, but they're better than mercury. So what do we ask you to do as a member of the IAOMT? And I know we got a lot of people here who aren't members yet. I really encourage you to join, but I want you to take this very seriously. I want you to get up to speed on your protecting you as quick as you can. It's not that hard. It looks scary. When we did our study, Maddie came in with all these dang spacesuits and said, I'm going to have to wear this how long today? 8 hours? Maddie, come on, really? Yeah, you got to do it, Joe. I don't want to put this crap on. Yeah, Maddie, we got to do it. We're covering up. This is where we got to do it because we're keeping the study the same. We're going to change these suits every time, but we got to do it because we got to have barrier protection. And we're wiping surfaces down, so we got to have a new surface every time. I said, okay. And then when I started to see the numbers going up in that room, what we were getting out as we took our controls off, how big the exposure was, I said, Maddie, can I put 2 on? Let me double up. I mean, people in the room, Bill was sitting over there, he was getting our the next stuff ready. I had a big teaching room at the time, and it's a big, huge room. Everybody in the room, we had protection on, full body protection, 8 hours that day. It was tough. Before we went in there, we checked the surfaces and all. We wanted to check for contamination. I had a really nice Oriental rug in there because I taught in there at the time. I was teaching CEREC stuff. And so one end was like a lecture hall, and we had a chair in there because we did some live demonstrations, and we had a big island that 10 dentists could sit around and do their preps and do their CEREC stuff. But there was a little Oriental rug in there about on the other side of the island from the chair. And my daughter wanted that because I told her we were moving anyway. We were building a new office. She said, I want that rug. I said, okay, well, if we test okay, you can have it, but I'm not having my grandkids crawling around on that rug if it's contaminated. So we took it and we measured it with the drone, and it peaked a little bit. We rubbed it a little bit, it peaked up some more. So we rolled up at least a $5,000, $6,000 rug, threw it in the dumpster before we started our program. And then we got to the end of the program where we were cutting dry, and I wanted to stop after cutting one of them out dry. But no, we got to keep our protocols for our studies so we get this thing published. We cut out 8 of them dry. The numbers were huge. And it was the last one of the day, and I said, all right, guys, let's just get out of this room and go talk about what we've done today. And we go up, and the doors were closed in this room, this big room, the doors were closed. So we go to the other side of my office where I had a couple of chairs that we did mainly hygiene in. And there was a drum laying in there, and we took everything off. We were talking about, I said, you know what, maybe we ought to check the levels over here. It was huge. The air conditioning system had just carried it over to that side. So I said, all right, we're going to get the hell out of this office. We opened up all the doors and windows, to the outside. We had 2 units, suction units, going all night long. We got out of there, and then we came in that next morning, and it was levels were down and things were better and cleaned up. And then we took the rest of Randall's amalgams out. So it's real. It's for real. It's a big deal. Okay, you really got to take these precautions. So, as an IAOMT member, we'd love you to get SMART certified, which is saying you're raising your hand to the public. I'm going to protect you. I'm going to do these protocols to the best of my ability. And it, cost-wise, you're going to spend $5,000, $6,000, something like that. Okay? And that's what it's going to cost. You can use social media. You can see patients love it. Don't worry about your patients. They appreciate you. They will tell you, they will write you up on that. Okay? So we got evaluation forms we want y'all to fill out at the end of the day.
Test.
Thanks for y'all's attention. We got a few minutes, I guess, for questions.
Is this on, guys? Hello? You hear me? We only have like 7 minutes.
7 minutes.
Hey, real quick though, just to dovetail that last comment you made, we made a video, I think it's on YouTube, where we ordered a brand new container of Mercury amalgam, you know, just the actual, those capsules, thank you. And we opened up the jar on camera. I pulled a little up, opened up, and had that little sniffer in there, and the number went over 350, like over 4.
When we were
unopened. I just opened the container.
When we were getting our typodonts ready for that,
Yeah.
we were measuring as we did
Yeah,
that.
as you open it up, yeah.
Oh God, you should have seen the levels in that
It's
room.
unreal.
We
Okay.
were packing all that amalgam in.
We got like 5 minutes for questions, and that's it. So it needs to be a good one. I don't want to, tell me again what you said. Nothing like that. Sound good?
Okay, it's not one of those. What can you tell me about addressing protective gear for your hygienists who are cleaning teeth all day long with people that come in with alloys everywhere? What protective gear can I give my hygienists?
Well, you definitely want to give her a respirator mask.
And don't polish the fillings ever.
And don't polish the fillings. Now, she's not going to create aerosols in particulate, but if she polishes the filling, she will increase the vapor that comes off. Okay? And because she's also breathing, when they exhale, there's mercury in the vapor, and I don't know how much exposure that is or how dangerous that is, but that's pretty much how we handle that.
Can you charge an extra fee for all of the smart equipment?
Oh,
that you're
yes.
using?
We charge, I think it's $180 per procedure. Maddie charges about $350. Bill, you working in your fee?
We just increased our fees.
Yeah, Bill just increases his fees, but we have an actual fee for that. And then there's a fee for if they do the IMD protocol, protection protocol, the supplement protocol, they pay for that also. So I make that their choice. I tell them you can do that. A lot of them are already doing chelation or have a naturopath that's treating them, so I don't tread on that. The ones that don't, we make that available to them.
I just had a quick question about when you're removing, let's say, like half a mouth of amalgams, like the right side, do you recommend, removing them first and then doing you have to get everything out and then do the restorative?
Yes.
Or do you have to do a rinse, like after you take off the rubber dam on the upper and then put it to the lower? Or do you have to?
If I'm doing the whole mouth, I don't rinse till we're done. Getting it out, but we remove all the amalgam first before we start putting anything back. Because we want to get rid of all those contaminated instruments. So I don't want to do that one time.